Let's change the subject and now go to health matters. Tonight we are shedding light on a condition that affects millions of women worldwide, often going undiagnosed for years, endometriosis. This chronic and painful disorder can significantly impact a woman's quality of life, yet remains shrouded in mystery for many. Stay tuned as we explore the symptoms, challenges, and latest advancements in the treatment of endometriosis. Take a look.
Endometriosis as a disease, it is explained as the presence of endometrial tissue outside the uterine cavity. Normally, the endometrial is the inner lining of the uterus. So when that inner line of the uterus is, the tissue from that part of the uterus is found outside the uterine cavity, we call it endometriosis. It can be found in the pelvis, especially to the ovary, to the tubes, fallopian tubes, to the peritoneum, but also it can be outside the pelvis region. It can go up to the diaphragm, it can be to the lungs and other part of the body. So it is a common disease because they affect around 10 to 15% in the general population. We don't have accurate number of patients having endometriosis in Rwanda, even on the worldwide, because it is a disease which sometimes it is unknown. People that don't know that they have endometriosis because they confuse some symptoms of endometriosis as the symptoms of other diseases that affect the reproductive system of the female patient. So about the etiology, etiology of endometriosis is not well understood, but there are some theories. There are many theories that explain how endometriosis occur. The most common theory is the theory of retrograde menstruation. Retrograde menstruation means that during a menstrual period, some blood flow goes back through the fallopian tubes and goes back to the pelvis, and endometrial cells can implant on different structures in the pelvis, including ovary, bowel, fallopian tube, and the peritoneum. That is the most common theory, but there is another theory which is a theory of hematogenous spread, where the endometrial cells can spread through blood system or lymphatic system and goes on the other side of the body, including lungs, including nose. Some women may present symptoms of endometriosis and have nasal bleeding during menses or coughing up blood during menses. So that may be explained by that theory of hematogenous spread. The symptoms of endometriosis, they vary, but the most common symptoms is pain. And this is a cyclic pain during menses, the pain which starts a few days before menses, during menses, and continue a few days after menses, when it is the initial stage of the disease. But with advanced disease, this pain may change in pattern and tend to be a chronic pelvic pain, which is no longer cyclic when it involves, especially when the disease is more advanced, when it's involving other deep structure of the pelvic region, like bowels or ovaries. That pain may change the pattern and become a chronic pain. That one symptoms that the patient may say. Another symptoms may be heavy menses. Heavy menses means when she's in menses, she bleeds a lot compared to what she used to. When advanced disease involving the bladder, you may even have blood in urine or blood in stool when the rectum or the large bowel is affected. Another symptom that women may say is about infertility. A couple or a woman is trying to conceive, but it doesn't happen. And that also may present as one of the signs of endometriosis. It has been found that among a patient with endometriosis, 50%, around 40 to 50% of them, they have a problem of infertility. And the degree of affection will depend on the degree of the disease. For mild disease, mild to moderate disease, patient may conceive. All may have a surgery depending how the disease is affecting the tubes, how blocking the tubes, how the disease is affecting the ovary. Surgery may correct for some pathology of that disease and patient can conceive. But for the severe form of the disease, where there is a severe adhesions and from the tuberous and the ovary, the conception may totally be not possible because of the disease, the extent. The disease is somehow curable, and the treatment will depend on the severity of the disease. There are many therapeutic options, starting by medical options. That means we use medication to try to control symptoms and decide that patient has, especially pain medication. This is a disease which is influenced by hormones. There is a hormonal treatment which is aimed to suppress those hormones that makes those endometrial cell grows. There are different types of hormones that can be used, and definitely the definitive treatment of endometriosis is surgery. Surgery where the disease is more advanced, that has caused more scarring, tissue adhesion, cysts in the pelvic region. Surgery is the mainstay of treatment for endometriosis. Of course, there are some cases of recurrence of endometriosis, especially where, as I say, that those cells, endometrial cells which are outside, I can't say surgery itself can eliminate all cells that are spread in the pelvic region, so it can occur. We will say that maybe endometriosis will be cured once the patient is no longer in the productive age. When is menopaused, no more hormonal, especially estrogen production from the ovary. That time is where we may say that some patient may have some cure of the disease because of they are no longer having that influence of ovarian hormones. The general population, whenever they think they have abnormal feeling during menses, abnormal pain during menses, especially when their menses, they are affecting their quality of life, it's affecting their daily activity. Some ladies, they are missing schools, they are missing their daily activity, they should consult. They should consult a doctor so that we do assessment, investigation to see if they don't have endometriosis and they start treatment.